Hello Nutrition 230. My name is Caitlin Deneen, and today I will be going to share with you a presentation on the impact of the gluten-free diet on obesity, metabolism, and any other health outcomes. Getting right into it. What is the gluten-free diet? Starting off simple, gluten is the main storage protein of wheat grains. While doing some research, I discovered that a gluten-free diet is the safest treatment for the treatment of patients with celiac disease and other gluten-related disorders. In other terms, a gluten-free diet is mainly used as a treatment with those with said gluten sensitivities. Celiac disease was mentioned in the definition of a gluten-free diet, but what is it? Celiac disease is an autoimmune disease where the ingestion of gluten leads to the damage in the small intestine. Celiac disease and gluten sensitivities are very genetic. There is a 1 in 10 chance of developing celiac disease if there is a first-degree relative who has it. As you should be able to see in the diagram on the slide, a damaged fold in the small intestine from celiac disease does not look the same as a healthy fold in the small intestine. The villi that are home in a fold of the small intestine become flattened, and the epithelial cells lining the folds are damaged. These damages impact the function of the small intestine in general. Now let's discuss how celiac disease can present itself. Celiac disease symptoms can be confused with a lot of other diseases, or even considered normal and not symptoms at all. Individuals with CD or celiac disease can experience symptoms that include nausea, fatigue, bloating, diarrhea, stomach pain, weight loss, headaches, and stomach pain. Graphics are a great way to summarize a topic that is being discussed, so I've decided that a few graphics in this presentation wouldn't hurt. After last slide's graphic, let's take a look at this one. This graphic in particular does a great job depicting what is included and what isn't included in a gluten-free diet in a fun way. When an individual participates in a gluten-free diet, they should be consuming foods such as eggs, potatoes, meats, fish, fruits, corn, and vegetables. Individuals that are participating in a gluten-free diet should not be consuming foods that include gluten, such as flour tortillas, beer, oats, pasta, wheat, and ramen. The original purpose, or the central goal of this video, is to bring awareness to the fact that despite there being an influx of gluten-free diets due to pop culture, social media, and the desire to pursue fad diets for weight loss, that prohibiting gluten from one's diet can have adverse side effects on one's health. Choosing the gluten-free diet to go into depth about was an easy choice for me, because my baby sister has had to reduce her gluten intake significantly due to an allergy, and taking this class has made me curious as to how that limitation has contributed to her health. Here is the part where we must dive deeper. What is the impact of a gluten-free diet on obesity, metabolism, and health outcome? Let's go find out. Now, what are the pros and cons of a gluten-free diet? Let's start with the pros. When an individual with celiac disease or a gluten sensitivity starts a gluten-free diet, it can relieve life-altering symptoms and make their day-to-day life easier and less painful. A gluten-free diet is proven to boost the energy of an individual where gluten inhibits the ability of one's bodily systems to function properly. Now, moving on to the cons. Type 2 diabetes is an adult-onset type of diabetes that is typically related to nutritional health. There is research done which proves that over a longer period, cutting gluten from your nutritional health can actually put you at higher risk for diabetes. There is no evidence that a gluten-free diet supports weight loss or any health benefits on its own. If a gluten-free diet is undergone hand in hand with an overall cleaner diet, it often can take credit for the weight loss that should actually be accredited to the cleaner eating. Why should you choose to adapt your diet to a gluten-free one? A gluten-free diet is perfect for those who have sensitivities to gluten or diseases that do not allow the body to digest and absorb gluten in a way that is necessary. A gluten-free diet will allow these individuals to gain back some healthy weight if needed, reduces stomach and defecating issues, and improves energy. It reduces migraines and headaches, and eliminates bloating that can be painful. Next, let's take a look at a gluten-free diet in terms of obesity and physical health specifically. Celiac disease and gluten sensitivity have been linked to weight loss and inability to maintain a healthier weight. Those with CD and gluten sensitivity can present as underweight and unhealthy with poor nutrition. This would be the opposite of obesity. A gluten-free diet aids in eliminating the weight loss from the inability to process gluten. As this presentation comes to a close, let's leave off with some ending thoughts and recommendations when it comes to a gluten-free diet. Research has produced this specific piece of recommendation, which reads, analysis of fecal mycobacteria and dietary intake indicated that numbers of healthy gut bacteria decreased, while numbers of unhealthy bacteria increased, parallel to the reductions in the intake of polysaccharides after following the gluten-free diet. After a brief look into how a gluten-free diet affects the healthy individual, it would be recommended that unless you have a diagnosis where a gluten-free diet is the best treatment, to avoid cutting gluten from your nutritional intake. There are little studies regarding how it affects a healthy individual long-term, but short-term, it altered the amount of healthy and unhealthy gut bacteria. This alteration could lead to a decreased immunology, weight loss, and a plethora of other negative side effects. Unless instructed by a medical professional to restrict gluten intake, avoid doing so as your health may be compromised. This works cited slide is all I have left for you today. Thank you for listening to my presentation about the gluten-free diet.